Good morning, Kevin.
Good morning. How are you?
I'm doing well. How are you?
I'm good. I'm good.
Are you excited to be in the podcast studio?
I'm very excited. First time I've ever done anything like this, so thank you for the invitation.
We've been talking about this for a long
Yes, we
time.
have.
You and I actually met through your work in assisted living. I was at Murata. I was doing sales at Murata, which is an assisted living community on the south side of town. And you had come in as one of the sponsors of Bingo.
That is correct.
So tell everybody what you do, and then
Okay.
we'll talk about what it is we're trying to do with this show.
So after that initial meet with you, we met again at the summit when they did a vendor event there.
That's right.
And then, so I did several events over there. But the name of my business is Ristau Insurance Services. I am a veteran-owned business. I specialize in Medicare and life insurance, and I am a community-based business. I have many, many clients in the area, very community-based, part of the Grand Prairie Chamber of Commerce, part of the Friday Rotary Group.
Mm-hmm. We do have two.
Yes, we do, but we are the Friday one. I have my kids are in GPISD. I have a son in 10th grade at South Grand Prairie. He's in a marching band. My little one is at Garner Fine Arts. He's in 2nd grade. They're both in Scouts. My older one, Max, is working on his Eagle. So my wife's heavily involved with that as well. So we're very, very community based.
And you live in Grand Prairie.
We do. We live down on the south side, down by 360. Yes.
So it was when we started talking about this, first of all, there's a lot of different types of insurance that you can sell.
Correct.
And you can sell, what all can you sell?
I can sell everything other than property and casualty. So like home, auto, stuff like that, I do not do. But I have some partners actually right in town that we refer each other out. So I do everything health related. Like my specialty is Medicare and life insurance, but I do everything: dental, vision, hearing, long-term care, home health. I do everything. But those are the two things that I really, really focus on.
What is it about that age group or that type of specialty that really speaks to you? What is it that you're passionate about with that?
I have many stories. So I have 9 brothers and sisters, and 7 of them are over Medicare age. So when I used to go back to New York after I moved away, I remember my parents.
Wait, you're not from Texas?
No. I'm from upstate New York. So
that was one of the things I loved talking to you the first time, because I was like, oh yeah, he's from somewhere, but you're Grand Prairie now. You're Grand Prairie.
I am. We've been here 15, going on 16 years. We love it here. Absolutely love it here. But I haven't been in New York in 30 years, but I remember going back to New York when my mom and dad were still alive. My mom used to have issues with her Medicare. She had no one to help her. And then as I got to get to the insurance industry, I did under 65. But when I started getting involved with Medicare, I realized there are so many people that they don't have a source. They don't know who to contact, especially lower income. I do a lot of lower income Medicare people, and they have no idea who to call for help.
Right.
So, it's a passion. I'll be there sooner than later. So, the more I know, the better, and I'm always available to help people.
Well, I will say I did not realize what I didn't know until I started working in assisted living. And you really start to understand the nuances of Medicare and all the different types of services that can be provided to seniors, and how they apply. Because this is one of the reasons you and I wanted to do this. It's because there's a lot of intricacies that come with Medicare. There's a lot of different plans that you can choose from.
Yes.
And this is the age group that is retired, and they get bombarded with advertisements on every single channel during the day when they're watching the news. And it's like, come do this, come do that, Medicare Part B, blah, blah, blah. I don't understand what all that is.
Yes.
And you really don't even understand it until it's time to use it and you realize what you have and what you don't have. So that's really what this show is going to be about, is you're going to try to help people understand what all the different types of ways that they can get Medicare, but then also how they can apply them. So we're actually going to have specialists like doctors, rehab centers, people that come on here and talk about, okay, you have Medicare now, how do you apply it to this particular thing that you might need? So maybe talk about, we're going into Medicare enrollment season. What does that even mean?
So you touched on so many things. There's such a variety of Medicare issues. So, you have people that have chronic conditions. They qualify for certain plans. You have people that are low income that qualify for certain plans. And today, I'm not going to name drop carriers or details of products. That's what we do when we get together for a free
Sure.
one-to-one consultation. But what I can say, Medicare is always changing, and there was a big change last year with the prescription part of Medicare. So what I do is when I get together with clients, I have a big base. I review every year. Of course, I get a lot of referrals. But what I'm also finding is, like you just said, in a perfect world, when people turn 65, they get on Medicare, Social Security, and they'd be retired. Well, a lot of people are working past 65,
Mm-hmm.
so there's different options. So when I get together with those people that might have employer insurance or some other kind of insurance, we sit down, review what's going to be best. Is it going to be best to stay where you are? It's going to be best to go on Medicare. I'm always unbiased. I always do what's best for the client. I don't push them one way or another. I have so many people that initially aren't ready, but they'll call me when they are ready. So I'm always available to help with that type of thing. But what I enjoy doing is helping people navigate the Medicare maze, Medicare Made Easy. And you're right, there's so much disinformation out there. And that's what those commercials are meant to do. They're
Mm-hmm.
meant to have seniors call in and deploy a lot of times. It's public access. They know what they do and don't have most of the time, and then they try to confuse them. So I'm here to clear all that up for people. And my ultimate goal with starting with you doing this is to be the Grand Prairie's
Yes.
Medicare man. So,
Yes. And that's where I think that this link is very important, because if I'm watching a show about a Medicare person that lives in a different part of the country, well, what we can do is provide them providers here.
mhm,
So down the street, there are these doctors, there's these rehab
yep,
center, there's these physical therapists that are actually, you can actually see in real life and
yep,
actually visit, and you're going to be the
yes,
one that's really helping them do that. And
yes,
I also like what you said about prescriptions. Medicare changes a lot.
yes,
So it's like you can be able to, in real time, educate people on things
yes.
that are happening in the industry when it comes to this. And I think that that's very, very important. And we have such a huge over 55 community in this city. So,
Well, I'm fortunate to be in a lot of groups in Grand Prairie, and I got to know a lot of people that are my clients now. And the great thing about that is we continue our relationship, and they can refer other people. But another thing is when you talk to a lot of people about Medicare, because they're confused and don't know the options,
mm,
and they don't know who to reach out to. There's a lot of seniors out there, and when I refer to seniors, 65 and older, although I know seniors probably don't consider them that, but a lot of them have no technology. They don't have the internet.
mm,
They can't get on social media to look up certain things. So I'm there to help them with that. I am unique. I still go do 90% of my appointments are face to face. A lot
mm,
of agents are over the phone, Zoom, whatever. I feel like you get a better relationship when you're with a person, just like you and me are right now in
mm-hmm.
person. I can help them look up doctors. I can help them look up medications while I'm with them
Sure.
versus on the phone. They can tell them whatever they want to tell them. So that's probably the biggest concern with seniors is just being misled. And
Oh, gosh, yes.
most of the agents just want to make money. They don't care how it's going to affect the seniors. That sounds horrible, but it's true. So
Mm-hmm.
I'm there to help with that stuff.
And I think that with Medicare, more than any other type of insurance like service,
Mhm.
they're going to have questions all year round. I mean,
Oh yeah.
for car accidents, for a roof situation, you might get one roof every several years. You might never even notice your insurance policy all
Correct.
year long. But with Medicare, it's not like that at all, because when
Correct.
seniors get to that age, they're using their Medicare all the time,
Yep.
sometimes multiple times a month. So if you are someone who is going to rehab because you've had a lot of falls, if you've been going to the
Hmm.
hospital frequently, every time you get your prescriptions, when you see your doctors, and a lot of times you have to see multiple doctors when you get to a certain age. Having
It's
someone
very
like
true.
yourself is so important.
So I do education, Medicare educational events throughout the year, and where you work, assisted living, that's different than senior independent living
Sure.
facilities. And
Mm-hmm.
of course, there's a lot of facilities now that you start with the independent living, and then they can work up the assisted living if they need it. But then their needs change, the plans change, the services change. So it's important for seniors every year, whether they plan to change or not, to at least get a review because there are a lot of changes. There's Medicare is almost a year-round thing now. I mean, special enrollments apply if you have a chronic condition, if you're low income, if you move, if there's different things. I am licensed in 27 states, but I'm trying to focus just now on
Mm-hmm.
DFW and Grand Prairie. I'm helping a lady currently in Michigan. I helped a lady a couple of weeks ago in Indiana. So I can help people wherever. And the neat thing about that is when I help people locally, sometimes they'll have relatives in other states,
Mm.
and that's working out pretty well. But the most important thing is I want to help the people in Grand Prairie know what's available and how it works clearly and correctly. Now, I
Yep.
can't always help everybody, but I keep a relationship anyway, and I keep in touch with people on a monthly basis and as needed. So,
Another thing that you kind of mentioned earlier is people that are still working.
mhm.
But we have a lot of people that have pension plans that are retired from places like GPISD, where they will get provided insurance for the rest of their retirement.
Yep.
And I don't even know how that works with choosing Medicare. That's something we could talk about in the future as well.
Yes.
My parents are retired educators. I know that that's something that is, something that they deal with all the time. So,
Well, that's similar to, you're right. I actually have a lot of GPISD teachers. I shouldn't say a lot. I have a few that don't like the option that they gave them.
mm,
And I have federal workers that retired and state workers, and they are offered benefits for after retirement. And a lot of times it's not always the best. Now, sometimes it is, but sometimes it's not. So when I sit down with those people, we look at what they have, what's available, and we decide what's best. Sometimes they switch, sometimes they don't, because a lot of times with coverage like that, they tell you, well, if you get rid of it, you can't get it back, and that
mm-hmm.
makes it nervous. But my thought there is if it's not the best plan, what difference does it make? So I can help those people as well.
Sure. Well, for this particular first episode, let's talk about Medicare enrollment. What
Yes.
date is that coming up, and how long does it last?
Yes. So what we have coming up, it's every year. It's called the annual enrollment period. Of course, it's going to be for 2026. I just literally yesterday got done with all my certifications, which is a lot of time involved with that. But
How does that
it's
work? Did you have to have certifications every year?
yeah, every year you got to certify with the carriers. You have to get updates and things like that, which is good. It's like a continuing ed, but you certify, which is good because you see all the changes and stuff. So the big period we have coming up is the annual enrollment period. It's October 15th through December 7th. During that time, anybody that has a Medicare plan can review 2026 plans. We can change them if they want to. They can change more than once during that time, and then whatever they have after December 7th, December 8th is what will kick in January 1st. Now, another neat part about that is actually October 1st, we can start talking about Medicare and the products for 2026, but we can't make any changes or enrollments till October 15th through December 7th.
So, can you change Medicare plans throughout the course of the year? Is it different than a regular insurance plan?
Depending on your setup.
Mm,
So if you have a Medicare supplement, which they call a Medigap, yes, that's an underwritten plan. So people can change anytime they want, and a lot of people do based on rate increases. If you have a Medicare Advantage or if you have a prescription drug plan, there's certain times of the year like the annual enrollment period for that. But if you do have a special enrollment, like I was talking about earlier, if it's a chronic thing or if it's an income thing or if you move or something like that, then or if there's a weather, natural disasters and stuff, then there's open enrollments, special enrollments throughout the year. So those are things when I get to people, I can help them check that out to see if one applies for them. Yes. So they're not stuck always. So sometimes they have other options. Yes.
So, on a baseline, like what is Medicare supplement? What is Medicare Advantage? Let's talk about definitions.
Yeah. So just some quick basic stuff.
Mm-hmm.
So original Medicare is part what they call Part A and B. A is inpatient, pretty much, and B is outpatient. So throughout our working careers or our FICA tax, we pay for Part A. So when you get ready to go on Medicare and turn 65, you don't pay for that part because you have paid for it. That's inpatient stuff. Part B is outpatient stuff, and there is a monthly premium. On average, it's $185 for this year, but if you're a higher income, it could be more. So when you have A and B, that's what they call original Medicare. Now, Part D is what they call a prescription drug plan. That's prescription drug plan. And the other letter is Part C, that's Medicare Advantage. So the difference would be if you're on original Medicare A and B, you can get a Medigap, like a Plan A and a Plan G. There's separate plans that you can pick from, and that will pretty much pay for everything that Part A and B does not cover, but there's a monthly premium for that. Then you would have to get a Part B prescription plan. So that's more like traditional health insurance. You have your A and B
Mm,
primary, then you have something to supplement it, and your Part B prescription. If you go with a Medicare Advantage, it takes your A, your B, and your D, wraps it into one plan, and whoever you go with, whatever carrier you go with, that's going to be your primary caregiver going forward.
I
But
see.
those type of plans, one is underwritten, one is not. Like the Part C, the annual enrollment, those type periods apply to that. If you go the other way, the annual enrollment applies to your Part D. So it can be confusing, but all these ads, like you were talking about and stuff, they do to try to confuse people on purpose so they call in.
Right.
I'm willing to sit down and literally show them, pull up their sites and all that stuff. So that way there's no confusion and they know what they have or don't have.
So, and when you say underwritten, you mean that in order to get into that plan, there has to be someone that looks at your health.
Yeah, so when you first turn 60, get ready to turn 65, you enter what they call the initial enrollment period. It's 3 months before, month of, and 3 months after your 65th birthday. Whatever month you're born, it's the first day of that month is when your Medicare kicks in when you turn 65. So during that period, you're guaranteed to get any plan you want, whether it's underwritten or guarantee issued. And that's important because people have health issues. It kind of locks in insurability based on their budget and their needs.
Mm-hmm.
So if they were not to get that during the initial enrollment period and they wait till after that, and they want to get it down the line, yeah, they can still get it, but it's an underwritten plan. They're health questions. They check your health history, your medication history, sort of like a health insurance or a life insurance. They do a background check to make sure you're a good candidate for it.
Right.
Whereas a Medicare Advantage, everything's covered from day one, even if you switch during the year. So there's a big difference there, and it's very, very important. That's a great question.
Mm-hmm. Well, in Medicare Advantage, if you know people that have Medicare Advantage, if you know how to navigate that system, but again, you have to navigate it,
It
and
can
that's
be
hard.
work. Well, another thing is
Excuse me.
if you have a Medigap plan like we were talking about, as long as a doctor accepts Medicare, you can go wherever you want. There are no networks. You don't have to have a primary. You don't have to referral. So it gives you more freedom, but you also have another monthly payment. If you go with a Medicare Advantage, they have HMOs or PPOs. HMOs are network designed. So for the most part, you have to go to a doctor in network unless there's an emergency. A lot of people put way too much thought into that because, again, in Grand Prairie, if you have an HMO with a big carrier, almost every doctor here. So as long as all your doctor specialists are network, you're good to go. A PPO allows you to go in and out of network, and that's for people that may travel a lot, that don't want to have a primary, that don't want to have a referral. So yeah, there's so much, Jenna, that we could talk about.
Yeah, for
and I know I'm kind of
sure.
rushing through it, but there's so much. That's why it's important people make an appointment with me. And, again, whether they do anything or not, I'll be a good contact. I helped one of my clients 2 weeks ago, 81 years old. She recently worked for a school district. She basically retired, but she's struggling with groceries and income. So I was able to hook her up with like a nonprofit that's helping her through all that. So I can help people with all that stuff, and I'm glad to do it.
So you have a couple things coming up that we wanted to talk about, and these are education classes.
Yep.
So talk about that, when they're coming, and what you're going to be talking about. So if people wanted to actually visit with you in person, where they can find you.
Yeah. So if you go on to if you go on to Facebook, Ristau Insurance Services, I have a site, and also Grand Prairie Medicare is my other site. I have this brochure that's on both of those.
And we'll share it onto the episode so people can see.
The neat thing about this is, as a member of the Chamber of Commerce, you get to use a conference room once a month, and I'm finally taking advantage of that. So Kevin and Brian and everybody over there has been great with me. So I have 4 upcoming dates. August 30th, which is Saturday. I didn't realize it was on the long weekend, but I'm going to be there. Even though we're supposed to go out of town, we're going to wait till after my meeting. So Saturday at the Grand Prairie Chamber of Commerce from 12 to 1, I'll be doing Medicare Made Easy. It's an educational event. I want to make that clear.
Mm-hmm.
I don't get into a lot of carrier details, plan details. It's just like we're talking about. It's an overview. I have PowerPoints and brochures and handouts for all that. So the dates coming up there are August 30th from 12 to 1. I'd love to have you. October 4th from 3 to 4. October 11th from 1 to 2. And also November 8th from 1 to 2. These flyers are posted on my websites, and of course, we'll post it here as well. So I would love to have anybody that, whether they're on Medicare, whether they're getting to go on Medicare, or I had kids the last time I did it that had parents on Medicare and they want to understand it better. So I can help anybody in any situation with the Medicare thing. And these are great classes because, again, it's not formal. There's no
Right.
pressure. I'm not trying to sell anything. I'm not even trying to make appointments. If people want to make an appointment with me afterwards, they can request it. And that's the extent of it.
And I will tell you that being around other people that are also Medicare patients and
Mhm.
recipients helps you understand how to better. That was one of the things I liked about assisted living. I feel like is a huge benefit is that you have a nurse that's on staff that
Yep.
deals with the providers on a regular basis.
Yes.
So she can actually help explain it to families what's good for that
Yes.
patient. And but then the residents get to talk to each other. And what these events get to do is you get to talk to other people that are in your same boat. So if you've
Yep.
been having a bad experience with your particular plan because maybe something has changed in your life, you can find out what are other options for you moving forward. Because just because you hit 65 doesn't mean that your health is going to stay the same for the next
Well,
several decades.
well, you're so right, and based on like the assisted living you worked at, and the senior independent living facilities that I do events throughout the year. I do bingos, I do all that stuff. But those people have one set of needs, and the assisted living have another set.
That's
So if
right.
they were to go from one to the other, their plans might
That's
change.
right.
Not only that, people's life circumstances change. They lose a spouse, they relocate.
Yep.
Um, their health
Especially for people
changes.
inside of their own homes that are trying to
Correct.
age in their home, there's a lot of opportunity they have to get certain
Yep.
types of help that a lot of them don't know that they have access to.
I was about to say that.
Mm-hmm.
So a lot of seniors are confused because they think that Medicare or the plan they have will cover long-term care, will cover home
Yeah.
health care,
Mm-hmm.
and that's not necessarily the case. I mean, if you want a private duty nurse at home, for instance, or if you want to go into long-term care, there's separate type policies, which, by
Yep.
the way, I have available. But again, that's their underwritten plan, so that's got to be in place. The younger, the better, because you get better rates. But Medicare doesn't cover all those things. And when I get
Right.
together with people, I can help explain that to them and make it clear how it works.
Sure. So do they need to RSVP or just show up?
No, no, no. Just show up.
Okay.
Just show up. If it gets to the point where we're packing out the room, then we'll do RSVPs. But last year I did a couple there, but I didn't do it right. I didn't advertise it right, and
Mm,
we had a couple good ones. We had one. I think there was 9 people. Was able to help a couple people. But going forward, we're doing Kevin over at the Chambers helping me. Put it on their site, and then of course this, and of course my site. So we're doing a lot better job. And one of the things I'll say about really trying to focus on being Grand Prairie's Medicare specialist is I can tell it's very important for people to have trust, and your reputation is everything. So when I help people, especially everybody knows everybody in Grand Prairie, so of course I'm always going to do only the best thing for people
hmm.
because my reputation depends on it. You can't always help people, you can't always make everybody happy, but my goal is to do my best with that.
Sure. Well, thank you so much. I'm really excited about this. I think
Yes,
this is such an important topic that so many people need help
yes.
navigating. So I appreciate you stepping out and being a part of this because I think it's going to be very, very helpful for a lot
Yeah, I
of
do
people.
appreciate it, and thanks for the invite. And I was nervous to begin with, but you make it so easy. So I hope everybody enjoys it. And again, contact me. We can meet wherever. I have a home office in Grand Prairie. I have a shared office in Arlington. I met a guy last week that actually works at Home Depot. I met him at McDonald's. So it's ever most comfortable for
That's
people, I
awesome.
will do it. So
Great. Thanks,
yes.
Kevin.
Hey, thank you very much.